This is starting to look really ominous in the South, the expert says, as the US is among nations with the highest rate of new COVID-19 cases. CNN. The US remains among nations with the highest rate of new COVID-19 cases, driven mostly by a surge in the South, where many states are lagging in getting people vaccinated against the coronavirus. This is starting to look really ominous in the South. If you look at rates of transmission in Florida and Louisiana, they are actually probably the highest in the world. Dr. Peter Hotich, the dean of the National School of Tropical Medicine at Baylor College of Medicine, told CNN's Anderson Cooper on Friday. Infection rates began in plummet in the US in the spring as vaccines became widely available, while the 7-day moving average of daily confirmed cases climbed in other nations, including India and Brazil, according to data from Johns Hopkins University. In the month of August, the US has so far reported more than 1.5 million new cases of COVID-19, more than 3 times the numbers for Iran and India, which now hold the second and third place, Johns Hopkins University data shows. And the 7-day average has topped at more than 135,000 cases, well ahead of other nations. On a state-by-state comparison, Louisiana has the highest rate of COVID new cases per capita, followed by Florida. That's how badly things have gotten out of hand. There's a screaming level of transmission across the southern states right now, and now we're starting to see this happening among younger age groups, Hotech said. Florida on Friday broke its own record high in COVID-19 cases over the past week, reporting 151,450 new cases, the most infections recorded during a 7-day period since the pandemic upended lives across the globe. The surge has been fueled by the more contagious coronavirus Delta variant, overwhelming hospitals across the country. In Louisiana, Governor John Bel Edwards said hospitalizations hit the pandemic record high of at least 2,907 patients, up by 6 people from a day earlier. They're not just the highest that we've ever been. They're almost a third higher than at any other point in this pandemic. Our hospitals are struggling. Staff remains the limiting factor on capacity. Our staffs at our hospitals, nurses and doctors and respiratory therapists and physicians, assistants, you name it, they're maxed out, the governor said Friday. Edwards said state hospital leaders are worried about the surges. I will tell you that I've never heard them express more concern, more alarm, or anxiety than they did this week, because we are rapidly approaching the breaking point, Edwards added. And in Alabama, there's an alarming uptick of infants as well as teenagers hospitalized with COVID-19, according to Dr. David Kimberlin, the director of the Division of Pediatric Infectious Diseases at the University of Alabama in Birmingham. We are seeing a lot of children who are very, very sick admitted to our hospital. We have almost twice as many right now as we did at the previous worst part of this pandemic, which were probably in January, Kimberlin told CNN's Eileen Burnett Friday. These children are coming fighting for breathe, fighting for the ability to basically get through this devastating illness. So many of them are on ventilators, maybe a quarter or so on ventilators or heart-lung bypass machines, he said. He adds that as children return to classrooms, it's critically important that everyone in schools mask whether they are vaccinated or not. I think the most efficient way to that is to have a mandate, to have a requirement that everybody needs to do so. And it saddens me that we seem to be fighting about the way we go about doing it. We all ought to, and we want to believe that we do have our own children's best interest at heart. We got to do this for them. State and local officials spar over mask and vaccine mandate. But masking children in schools has become increasingly polarizing, especially in states where vaccination rates are lagging and COVID-19 infections as well as hospitalizations continue to increase. President Joe Biden spoke with children's superintendents from Arizona and Florida on Friday to thank them for keeping their students safe despite bad public health measures taken by governors, according to a White House official. Republican Governor Ron DeSantis of Florida and Greg Abbott of Texas have issued executive orders that ban mask mandates in their state. DeSantis, however, went a step further and threatened to withhold the salaries of superintendents and school board members who disregard his order. On Friday, White House Press Secretary Jen Psaki criticized DeSantis. As a parent myself of 2 young children, I want public health officials to make a decision about how to keep my kids safe, not politicians, Psaki said at press briefing. Not only is Governor DeSantis not abiding by public health decisions, he's fundraising of this. The Texas Court of Appeals on Friday ruled against Abbott, upholding that mask mandates may remain in Bexar and Dallas counties. Abbott had requested the appeals court to stay ruling from 2 lower courts that decided mask mandate in those counties can be effective, despite the governor's executive order banning mask mandate. In Arizona, education groups are suing the states of banning public schools from imposing mask and vaccine mandate. The Arizona School Board Association, the Arizona Education Association, and other advocacy groups filed the lawsuit Thursday, arguing that the new laws favor private schools over public districts because they don't apply to private schools. Students in Arizona's public and chartered schools will be less safe in their educational environment than students in private schools, the lawsuit states. The lawsuit seeks to overturn the bans on mandate. Arizona Governor Douglas Ducey and Attorney General Mark Brinovich did not respond to requests for comment Friday. This legislative session was unprecedented. The legislature enacted substantive laws in budget reconciliation bills without notice to the public and on subjects that are completely unrelated to one another. Plaintiff attorney Lou Pelli HDSI said in a written statement provided to CNN. Third dose for immunocompromised is not a booster shot, the expert says. Meanwhile, the U.S. Food and Drug Administration on Thursday authorized an additional third dose to be administered to people with compromised immune systems. And on Friday, vaccine advisors to the CDC voted unanimously to recommend the additional dose for some immunocompromised people. CDC Director Rochelle Walensky quickly endorsed the vote, which means people can begin getting third doses right away. On Friday, Michael Osterholm, the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, said it's important not to confuse that third dose with a booster shot. They are really about finishing a primary series. Think about childhood immunizations. We have vaccines for which we need 3 or 4 doses. What we found here is that the immune-compromised often didn't mount the adequate response at all. So we're still trying to build that. That is different from booster dose, where someone did response, and in fact, over time, that wanes. Osterholm told CNN. I think it was a great decision. At a meeting of CDC vaccine advisor, Dr. Heather Scobie said a disproportionate number of vaccine breakthroughs are among immunocompromised people. Almost one-third, 32% of vaccinated breakthrough cases are among that group, she said. While immune-compromised people make up about 2.7% of the adult population, about 7 million people, they are more vulnerable to infection, said Dr. Armantha Kohn, Executive Secretary of the CDC's Advisory Committee on Immunization Practice. She said vaccine effectiveness is about 59% to 72% in immunocompromised people, compared to 90% to 94% overall. Immunocompromised people are more likely to get severely ill from COVID-19. They are at higher risk for prolonged SARS-CoV-2 infection and shedding and viral evolution during the infection and treatment, particularly amongst hospitalized patients, Kohn said. CNN's Ray Sanchez, Jason Hoffman, Virginia Longmate, Rebecca Reese, Dina Hankney, Andy Rose, and Lauren McCullen-Huss contributed to this report.